So hello everyone, welcome to the GDC classes. My name is Devanshu. Today we are going to learn what is metabolism. Metabolism comes under the pharmacokinetics. So in the previous lectures we have discussed the introduction to general pharmacology, routes of administration, and then absorption and distribution. So in today class we're going to learn what is metabolism. So let's start it. So metabolism or biotransformation is defined as the chemical alteration of drug in the body. So what is bio over here? Bio means the body, and the transformation is correlated to chemical alteration. Chemical alteration in what context? In the context of the uh, conversion of lipid soluble to the water soluble drug. There is a many chemical alteration regarding to the functionalization, addition of the functional group that will cover in the later stage. So let's see the definition of metabolism. Metabolism of biotransformation is defined as the chemical alteration of drug in the body. Okay. So what is the primary site of the metabolism? It is usually liver. Apart from liver, it may be lung also. It may be saliva also, where we do have salivary enzymes. Okay. Then some kind of metabolic reactions comes under in kidney also. So there are many different types of sites where metabolism may occur. Okay, but majorly the metabolism may occur through liver. Okay, then metabolism of drug usually converts. So what metabolism exactly do? It usually do what conversion of which drug? The lipid soluble drugs will be converted into the water soluble. So why it is required to convert the drug into water soluble? Because when the drug gets into its water solubility, then only it can be excreted through urine. Okay, for the excretion process, for the elimination process of the drug through the body, out of the body, it has to be under the water soluble category. Okay, so how it will convert into the water soluble category? That is all about the metabolism. Okay, so lipid solubility, as we have discussed before, whenever the drug will be in the unionized form in the same medium, that will be called its lipid solubility. For the absorption purpose, it has to be under lipid soluble. Okay, and then this lipid soluble drug will be converted into the water soluble for the excretion process. Okay, excretion process in which the drug will move out of the body through urine. Okay, next, same unionized compound will be converted into the ionized compound, so it can be soluble in water and will ease for removal from the body. Okay. Third one is inactive prodrugs. So there are some prodrugs also which are initially in its inactive form, but after the metabolization, it is converted into its active form, which is responsible for their pharmacological action. Inactive drug goes biotransformation prior to show pharmacological response. Okay. So firstly, we have taken a prodrug, then it will go for the metabolization. After metabolization, it will be show some new metabolites, active metabolites, which are responsible for its pharmacological action. After its action, after some time, whatever the half life or duration of action of that drug, after it's showing its drug action, it will again go towards the liver and will show the biotransformation and will readily to excrete out from the body. Okay, so there will be two metabolic reactions in the case of prodrug. Okay, so there are three types of metabolic reactions. First one is active to active drug metabolite. Second one is active drug to inactive drug metabolite. And third one is inactive to active drug metabolite. Inactive to active metabolite is a prodrug example, which I have told you just now. In the case of prodrug, there is first the drug will be inactive form and then it will convert it into its active form for its pharmacological action, and after some time when the drug action is over, then when the drug has to be removed from the body, it has to undergo a metabolic process again, and this time it has to be converted into the inactive metabolite. Okay, inactive metabolite. Then what kind of a metabolic reaction will take place? Say this second type, active drug to inactive metabolite. Okay, so this time active drug to inactive metabolite will take place, and from that the drug will be readily to excrete out from the body. Okay, so let's have some examples of these types of reactions. Inactive drug to active metabolite, that is prodrugs. So proguanil will be converted into the cycloguanil. It is in what? It is an anti-malarial drug. Okay, levodopa converted into the dopamine, which has a pharmacological action. Prednisone into prednisolone. Acyclovir, antiviral drug, which is converted into acyclovir triphosphate. Cyclophosphamide, which is an anti-cancer drug, converted into aldophosphamide or acrolein. And then enalapril to enalapril, which is a ACE inhibitor, usually used in the antihypertensive as a antihypertensive agent. Okay, so let's move towards the example to active metabolites. So here there are some drugs which is in the active form. When you take an orally, it is in the active form, but ultimately it also release some new active metabolite which has its some pharmacological action. Okay, so what are the examples of it? Examples are amitriptyline to nortriptyline, codeine to morphine, diazepam to oxazepam, spironolactone to canrenone, allopurinol, alloxanthine, phenacetin to paracetamol. This is important. Phenacetin to paracetamol. Okay, so let's move towards the what are basically the enzymes, the drug metabolizing enzyme. Which kind of enzymes are responsible for the metabolic reactions? So there are two types of enzymes: microsomal enzymes and non-microsomal enzymes. So their location is different. Microsomal enzymes are located into the smooth endoplasmic reticulum and basically responsible for the lipid synthesis. Okay, for example, monooxygenase is cytochrome P450. Okay, next one is non-microsomal enzymes. So it is present in the cytoplasm, rough endoplasmic reticulum, and mitochondria, which is responsible for protein synthesis. Examples: flavoprotein oxidases and esterases. Okay, so there are two types of microsomal. There are two types of metabolizing enzyme. First one is microsomal, and second one is non-microsomal. This has to be remembered by you. This concept will be taken forward. Okay, the most important enzyme for the oxidation reaction is cytochrome P450. This has to be learned. So now, for example, cytochrome P450. It has a wide range of enzymes under it. Okay, for example, CYP3A4. CYP3A4 is one of the major enzyme for metabolizing around 33% of the drugs. Okay, so in this CYP3A4, CYP is cytochrome, P for pigment, and if we talk about the 450 has a absorbance in which they emits some light. Okay, so cytochrome P450 has a lot of um, enzymes under it. For example, CYP3A4. 3 signifies family, A signifies gene or subfamily, 4 signifies gene number or a specific isoform. Okay, this has to be learned by you. It has been asked in various exams. What is the reference of 3? What is the reference of A? And what is the reference of 4? It has been asked in GPAT exam also in previous times. Okay, so 3 is related to family, A related to gene or subfamily, 4 is related to gene number or specific isoform. Okay, so here are some notes that CYP3A4 forms the maximum hepatic content, around the 100% of hepatic content, out of which 26% has been covered from CYP3A4 only, and is involved in the metabolism of maximum percentage of drugs, that is 33%. 33% of the drugs marketed, that is metabolized through CYP3A4 enzyme only. Okay, so you can see how much the bigger role has been playing by CYP3A4. Okay, now CYP2D6 is involved in 23% of drugs. So after CYP3A4, the second most metabolizing enzyme that has been used through liver is CYP2D6. Although it involved 2% of hepatic content only. It contains only 2% of hepatic content only, but still it playing a major role to metabolize the 23% of drugs. Okay. Now there are some more drug metabolizing enzymes. So these enzymes can be some drugs also. Okay, so there are two types of drug metabolizing enzymes. Apart from microsomal and non-microsomal, there are some inducers and there are some inhibitors. Okay, what are the inducers? Inducers are which exaggerate or which increasing the drug metabolizing capacity of other enzymes. Okay, so enzyme inducers are increase the metabolism of other drugs. Therefore, dose of such drugs should be increases. So in this case, when there is a drug and there is a B drug, when A drug is inducing the metabolism through other enzymes, so what will happen? The metabolizing the metabolism of B drug will be increased. So whenever the metabolism of B will increase, the activity gets low, the efficacy gets low. So in this case, what has to be happen? What should be happen? That the dose of drug B should be increased in order to what? Um, in order to have a proper efficacy or activity on the specific organ or specific disease. Okay. So in this case, inducers increases the metabolism of other drug. It induce what? It induce the metabolism of other drugs. Therefore, dose of such drugs should be increases. So through a trick, you can learn what are the enzyme inducers. Examples of these enzyme inducers are the GPRS cell phone. This is a trick through which you can learn these examples. GPRS cell phone. So G for rhizophlavin, P for phenytoin, R for rifampicin, S for cigarette smoke. Cigarette smoke is also an enzyme inducer which increases the metabolism. Okay. Cell, carbamazepine, phone, phenobarbital. Okay. So now we're gonna learn what is enzyme inhibitors. So enzyme inhibitors are the substances which decreases the metabolism of other drugs. So this can be the drug also. It can be drug also, but it is what? It is decreasing the metabolism of other drug. For example, drug A and drug B, these are having interactions between them. Okay. But what is happening? The drug A, for example, the ketoconazole. Okay, ketoconazole is enzyme inhibitor. The ketoconazole is having an interaction with drug B. This is what is doing. It is doing the decrease in metabolism of drug B. Okay, so what will happen when the metabolization rate of drug B goes low? So when there is lower drug metabolism of drug B, so it will start to accumulate. It will start to accumulate inside the body. So what will happen when the drug is started accumulating in the body? It will have some drug toxicity. So enzyme inhibitors are known to have drugs toxicity whenever they have drug interaction between some other drugs. One of the drug should be the enzyme inhibitor for causing the toxicity. Okay, so in this type, what should be happen? So whenever you have to take a drug, you have to remember whether it is an enzyme inhibitor or not. If it is an enzyme inhibitor, then the dose of drug B should be low down. So it is the only way through which you can prevent the drug toxicity. So these are some trick through which you can learn or remember these enzyme inhibitors examples. For example, vitamin K cannot cause enzyme inhibition. Vitamin K, V for valproate, K for ketoconazole, cannot cimetidine cause ciprofloxacin, enzyme erythromycin inhibition, isoniazid. Okay. So these are some examples through which you can learn enzyme inhibitors and enzyme inducers. This is very important topic you have to learn because through this topic only you can get easily questions. Okay. Through this trick you can remember all these examples. So let's move towards the metabolism reactions. Okay, so there are two types of reaction: phase 1 reaction and phase 2 reaction. Okay, the phase 1 reaction have both microsomal and non-microsomal enzymes. Okay, for examples, oxidation, reduction, and hydrolysis. This comes under the phase 1 reaction. This phase 1 reaction does not ensure whether the drug has to be completely undergo the water solubility or not. This does not ensure. But phase 2 reaction, which is also known as the conjugation reaction, this will ensure you that the drug is finally or completely now water soluble and ready to go outside the body. Okay. So for what are the examples of phase 1 reaction? Phase 1 reaction are oxidation, reduction, and hydrolysis. So there are some questions in which they have asked what is the most common uh, drug metabolizing reaction in phase 1. So the oxidation reaction is one of the most common reaction in phase 1. So in the same way, what is the common reaction in phase 2 reaction? That is glucuronide conjugation reaction is the most common reaction. Okay. Now, these reactions, oxidation, reduction, and hydrolysis, these can carried out by both the enzymes, microsomal and non-microsomal enzymes. But in phase 2 reaction, except glucuronide reaction, all the reactions are taken place by non-microsomal. Okay, non-microsomal. So you can learn this by a trick that is hero. Hero. H for hydrolysis, E for accept glucuronide, R for reduction, and O for oxidation. Okay, so these are the reactions which can be taken out by microsomal enzymes only. Okay, so hero, H for hydrolysis, E for accept glucuronide, R for reduction, and O for oxidation. And rest of the reactions can be carried out by non-microsomal enzymes, for example glutathione, acetylation, methylation, and sulfation. So phase 2 reactions are conjugation reactions. Okay, so there are conjugation will be take place. Okay, in phase 1, there are functionalization reaction. That is, here will be a addition or as well as removal of some functional groups. Okay, let's move forward. Now, phase 1 reactions. What are the examples of phase 1 reaction? Oxidation, in which there is an addition or removal of hydrogen. Very simple definition. But what are the examples of it? Examples are phenytoin, phenobarbital, and propanolol. Propanolol is from which category? It is from beta blockers. Okay. Reduction is removal of oxygen or addition of hydrogen. So you may be confused whether oxidation, in which oxidation, O for oxygen. But in the same way, in the same context, oxygen has to be removed in the case of reduction only. Don't go for removal of hydrogen here. In the same way, there is a removal of oxygen in reduction and addition of oxidation. Okay. So triple P, phenytoin, phenobarbital, and propanolol will undergo the oxidation process. Chloramphenicol, methadone, that is chief master, chief master will be reduce, that is reduction. Okay. Hydrolysis is the breakdown of compound by addition of water. So there may be only esters or amides. Okay. Procaine, aspirin, lignocale, procainamide. Okay. These are some examples which comes under the hydrolysis. Then cyclization, proguanyl into cycloguanyl. These are also a phase 1 reaction. So at the end of phase 1 metabolite may be active or may be inactive. It has to be either way. It can be active or inactive. For example, in the case of prodrug, the inactive drug metabolizes, then converted into, it will be the active form. For example, if you are taking the active drug, for example, aspirin. Okay, so aspirin, acetyl salicylic acid converted into the salicylic acid. Salicylic acid will be readily to excrete out from the body as an inactive form. Okay, then let's move towards the phase 2 reactions. Phase 2 reactions are particularly the conjugation reaction. Okay, there will be a conjugation take place. So most common reaction is glucuronide conjugation. Okay, so there are some enzymes also which are basically transferases only. So glucuronide conjugation uses the enzyme UDP, diphosphate uranosyl diphosphate glucuronyl transferase enzyme. This enzyme has to be remembered by you. And then the examples are chloramphenicol, aspirin, and phenacetin. Okay. Glycine conjugation, acetyl CoA glycine transferase, salicylate, and other drug having the carboxylic groups. Glutathione, glutathione transferases for paracetamol and phosphomycin. This is very important, that which phase of reaction and particularly which reaction is responsible for the metabolization of paracetamol. So you should learn that is glutathione reaction, glutathione conjugation reaction is responsible for the metabolization of paracetamol. Acetylation and acetyltransferase. Examples are isoniazid, sulfonamide, and etc. So this is all about the metabolism topic. I hope you like the video. I hope you understand well. So thank you so much and stay with GTC.